Gaining or regaining the ability to eat is a major milestone for a child and their family. We spoke with Dr. Mitchell Katz at Children's Hospital of Orange County, who talks to us about Choc's multidisciplinary feeding program.
What it is we look for children with extreme feeding problems. Our target age group is between the ages of 2 and 6 years of age. Children predominantly who are dependent on tube feedings or have such disordered feeding behaviors wherein they are extraordinarily limited to what they can or will or are able to eat. The majority of our children, particularly the children with feeding tubes, but even those without, have had problems since very early in life. Whether they're identifiable medical problems such as premature infants, children who have had multiple surgeries, multiple medical interventions or surgical interventions, prolonged illnesses. Many of those children develop feeding aversions. There are other situations that can lead to feeding problems, such as something as simple as gastroesophageal reflux, heartburn, allergies. So what we're looking at are the children with extreme feeding problems. The children who have developed very disordered feeding problems over several years. This is not a one-off or a one-time experience. These are children who have been doing this for years. And it's our goal to change the behavior, change the dance, teach the child and the parent a new relationship with food and with each other. And that's what a multidisciplinary program is built for, to bring in multiple aspects of and multiple expertise into teaching this child a better relationship with food. Our program is for the worst of the worst, the ones who have failed the primary care provider, the specialists, the kids who are in feeding therapy who are just not making any headway.
Dr. Katz gave this advice for parents who think their child is having difficulty with feeding.
If you're having difficulty feeding your child, the first question is why? What is the child's motivation to refuse to feed? And what is the child gaining by his behavior? Set your goals. Say, I would like this meal time for him or her to do what? And then you set gentle but persistent goals. And you reinforce good behavior. You don't reinforce bad behavior. Second thing is, we would love our children to eat a balanced meal. But that doesn't always work. If you try to get the child to eat all their vegetables, their fruits, and meats and all, the child may not like it. And if the child misses a meal, is it that tragic? It's okay sometimes to give the child a safe meal, a desired meal. Don't make every mealtime a battle. The third thing is get everybody on the same page. The parents are the leaders. The parents set the goal. And the last thing is, don't create a battle at the table. If the child's hungry, let him eat. If the child's done, let him be done.